The deadliest STDs in the world. Most people talk about STDs like they're a joke because some of the symptoms can be pretty embarrassing. They're no laughing matter, though, and some can plague you for the rest of your life. In some cases, they can even be deadly. According to WHO, over 1 million sexually transmitted infections, STIs, are acquired every day worldwide. According to the University of Maryland Medical Center, it's crucial to know which ones pose the greatest risk. While these 3 STDs might not be a guaranteed death sentence, they can be fatal. 1. Human immunodeficiency virus, HIV. The reason you hear so much about HIV is because, as the Centers for Disease Control and Prevention (CDC) explains, it destroys the cells that help our bodies fight off disease and infections. This weakened immune system makes you more susceptible to serious conditions like cancer and acquired immunodeficiency syndrome (AIDS), and either one is a cause for concern. AIDS.gov says AIDS is the final stage of HIV, the point at which the immune system is weak enough that you're incredibly vulnerable to illnesses that can be life-threatening like tuberculosis and recurrent pneumonia. If patients diagnosed with AIDS who aren't receiving treatment fall ill with one of these conditions, their life expectancy drops to just 1 year. Unfortunately, there's no cure for HIV. However, the virus is treatable and many people live full, healthy lives. Kaletra, lopinavir, ritonavir, is a prescription medicine that is used with other antiretroviral medicines to treat human immunodeficiency virus 1 (HIV-1) infection in adults and children 14 days of age and older. However, it is not known if Kaletra is safe and effective in children under 14 days old. Obviously, prevention is best, so speak with your doctor about measures you can take to help reduce your risk. 2. Hepatitis B. Most people probably received the Hepatitis B vaccine series when they were still babies, but there's still some risk of contracting it. According to the CDC, hepatitis B is a contagious liver disease that's often spread through sexual conduct, at least among adults. Some are lucky enough that the infection clears up after 6 months, but others develop chronic hepatitis. This long-lasting liver infection can cause cirrhosis, which the National Institute of Diabetes and Digestive and Kidney Diseases explains as liver breakdown that may lead to further problems, such as diabetes, lung and kidney failure, and liver cancer. To lower your risk, make sure to get vaccinated, use condoms, and try to limit sexual partners as much as possible. 3. Human papillomavirus, HPV. Human papillomavirus (HPV) is an infection that's part of a group of more than 200 related viruses, according to the National Cancer Institute. More than 40 of these viruses can spread through sexual contact. Since there are many different types, HPV doesn't always result in the same outcome. In fact, the CDC says most cases are harmless and can go away on their own. But if they don't, that's when they can be troublesome. When HPV remains in the body, it can cause genital warts or even lead to cancer. The CDC mentions, while cervical cancer isn't the only type of cancer that can result from HPV, it's the most common type linked to the virus. And just like any other cancer, it can be deadly. To protect yourself from HPV, speak with your doctor about getting vaccinated and practice safe sex. If you want more sexual health educational topics, please make sure to subscribe our YouTube channel and click the bell icon for you to get notified whenever a new video is released.